Hello, my name is Asosa Olumaroti, and this is my patient, David Olumaroti. David, do you give me consent to record this video? Yes. This is a HEENT head, eyes, ears, nose, throat exam for advanced health assessment NU 650. I will begin off by assessing my patient's head and inspecting for the general size and contour of the skull, noting any deformities, depressions, lumps, or tenderness, and as well as inspecting his face and noting the expression, contour, symmetry, involuntary movements, edema, and masses. So you could look at me, or you could just stare forward. I'm just opening my eyes. And once again, before I started this video, I did perform hand hygiene. It looks symmetrical. No involuntary movements, edema, or masses noted. Do you feel any pain as I'm touching your face? Any pain? Okay, perfect. And now I'll just start off with the eye exam. The eye assessment, that is, and just start with inspection. So no equipment here. Inspecting the eyelids, the eyelashes, the palpebrals, fissures, alignment of the eyebrows, as well as inspecting the lacrimal apparatus, the conjunctive eye. Sclera, noting the color, swelling, discharge, vascularity, or nodules, and as well as inspecting the cornea, lens, and pupils, noting the opacity, size, shape, and symmetry. I'll have to sit down for this one. I'll just be touching your face here. Could you please look up? Thank you. To the right. To the left, please. And down. Thank you. Everything appears to be symmetrical. Any pain in those areas? Perfect. Thank you so much. Alright, now we'll test your vision. Do you wear any corrective lenses? Are you wearing any contacts? Okay. I'm going to hold this chart. It is a handheld chart. This chart specifically says hold 6 feet away, so I'm going to hold it 6 feet away from my patient. And I'm going to hold it 6 feet away, and if you could close your left eye and tell me the smallest line you can read. And then with your right eye, read the smallest line.
LTFH.
Perfect. Now if you could switch it to the other eye.
Smallest line again?
Yes, sir.
LTFBH.
That is correct. Thank you so much. Okay, and now we're going to move over to assessing the pupillary response to light, direct and consensual. At this portion, I'll just be passing the light through your eye. It won't be a huge bright light. Before that, I'll go ahead and assess your pupillary size. With this, you just open your eyes as wide as you can. Perfect. Thank you. You could just look forward. Thank you. Making sure I'm not blocking the patient. Now let's see, because I can't stand in front of the camera, I'm just going to stand a little bit off to the side and assess your visual fields. If you could just follow my finger, please. Just stand forward. Just with your eyes, not your head. Perfect. Thank you so much. And now, I'm going to hold up this red pen and let me know if you could just face forward whenever you see the red top. Let me know when you see the red.
I see.
Okay.
I mean,
You're
I
supposed
saw
to.
it prior to that. Oh, wow. So you were talking about peripheral vision?
Correct. Just let me know whenever you
Okay.
see, when you first see red. I'll do it again.
I see.
Okay.
I mean, do I have to distinguish the color or when I
No,
just see
just whenever you see the red.
it?
Like when it comes into your vision. Whenever.
Do I have to distinguish the color?
Oh, no. Yeah, whenever you see it.
See.
Okay. Perfect. Now I'll perform the wiggle test for visual fields by confrontation. If you could just look forward, I'm going to be wiggling my fingers and let me know whenever you see my fingers start to wiggle.
Mm-hmm. Mm-hmm.
Thank you. And now I will stand 2 feet apart, 2 feet away from the patient and check for extraocular movement as well as include convergence known as stigmas in the eyelids. So if you could just look directly into this light. Thank you so much. And now I'll be performing my ophthalmoscope exam in which I will be assessing the patient. I have changed the settings from full percent brightness to only 80% brightness. And let me show you. And also turning the diplometer dial down to 0. It is currently on 0 now. I'm using my same side right, and I'll examine the right eye. If you could just look straight forward to me, please. Thank you. On the left side, my left hand. Thank you. Now I'm going to go ahead and start on the ear portion of the assessment. And I'm just going to start by inspecting the auricles as well as the surrounding tissue for symmetry, deformities, lumps, and lesions, as well as inspecting the ear canal and noting any discharge, foreign bodies, redness, swelling, cerament. And I will use my otoscope for this, as well as the largest piece of the equipment. Start off with inspection. Now, are you having any trouble hearing out of either ear? Okay. Turning my device on. And because it's an adult patient, I will pull the pin out of the ear up slightly backward, holding firmly and a little bit out towards the ear, so I'll be able to view the inside of the ear canal more clearly. Thank you. This ear. Thank you. And now I will go ahead and perform the whisper test. If you could please, patient, cover up your left ear with one of your fingers. Your left ear, please. Thank you so much. I'm going to whisper a word in your ear if you can let me know what that word is.
Leopard.
great. Thank you so much.
Solid.
That's correct. Thank you so much. And now I'm going to go ahead and do the special techniques and do the Weber test as well as the Rene test. I'm going to strike this tuning fork and put it on your head and let me know if you hear anything in one ear or both ears. Are you hearing in one ear or both ears?
Nothing.
Okay, I'll do it again. Do you hear it in one or both ears?
No.
Both? Thank you so much. And now the Rene test to compare the air conduction and bone conduction. I'm going to go ahead and strike the tuning fork again and place it behind your ear, and then let me know when you stop hearing sound. Let me know when you stop hearing sound.
Yeah.
Do you hear the sound? Thank you. And I'll do it on the other side. Stop hearing the sound.
Stop.
Do you hear the sound? Thank you. And now I'm going to start off with the assessment of the nose. First, I'll start off with inspection, just inspecting the symmetry and checking for asymmetry, lesions, and deformities, as well as palpation and palpating the nares to assess for nasal obstruction. Have you had any problems breathing recently? Okay. See the midline. Do you have any pain? Perfect. Symmetrical, no lesions or deformities noted on the outside, and I will use my otoscope as well to inspect the inside of the nares and noting for color, swelling, bleeding, exudate, ulcers, or any polyps or nasal mucosa deviation, as well as information or perforation to the septum. I'm just going to go ahead and check the tip of your nose. Thank you. Thank you. Now I'm just going to use my hands to palpate for the frontal and maxillary sinuses for tenderness. Do you feel any pain? Any pain? Thank you. And now we're going to test your sense of smell. I have two scents here for you. I'm going to ask you to cover up one nostril and smell the item that I placed before you, and then we'll do the same with the other nostril. So if you can please cover up, that's correct, your left nostril, smell out of your right nostril.
Grape?
That is a grape, that's correct. And now, we're going to do the same. If you could close your right nostril and tell me what you smell out of your left nostril. That's correct. It is a lemon. Great. Should I discard those? And now I'll move on to the assessment.